Normal foot X-ray views. Normal foot X-ray views. A foot X-ray view is the first image you see on a radiograph of a patient. This view is known as the standard projection. It shows the foot from the front, back, and opposite side. There are many differences between the two views. A good quality X-ray is essential to a correct diagnosis. However, when the image is poor or has too much detail, it may be time to change your technique. A normal foot X-ray should have all of the bones visible. Normal foot X-ray. The X-ray should be taken when the patient is weight-bearing, unless there's a significant problem, like a fracture. There are 3 different types of these X-rays: the anteroposterior, dorsoplantar, and lateral. The base of the 5th metatarsal is the most common type of fracture. This injury is usually the result of an inversion injury. There are 3 types of normal foot X-ray views: oblique, medial lateral, and anteroposterior. Whenever possible, an X-ray should be taken when the foot is in weight-bearing. An X-ray should show all bones and joints, including floaty bits, which are likely anossical. Small avulsions are often missed. A normal foot X-ray view consists of the medial and lateral views of the foot. The anteroposterior view will show the medial elements and cuneiforms. The dorsoplantar view will show the articulation of the Lateral joint. The interphalangeal joints will be obscured, but the metatarsophalangeal joints will be well visible. The sesamoid bones are a common abnormality, but not a life-threatening one. A normal foot X-ray can show the medial cuneiforms and the 2nd metatarsal. Normal foot X-ray, the cuneiforms and 2nd metatarsal should be aligned. When there is a disruption of the Lateral ligament, the foot will be unstable. MRI is the most accurate way to diagnose a Lateral injury. In this type of injury, the 2nd or 3rd metatarsals must be aligned to the other bones. In contrast, a normal foot X-ray can be misleading if it fails to highlight the medial elements. The medial cuneiforms are easy to miss, but the articulation of the Lateral joint is very important. The interphalangeal joints and lateral column are both visible on a normal X-ray. The bones are generally in a straight line and are well aligned. A foot X-ray is a crucial tool in diagnosing various orthopedic problems, including amputation and fractures. A properly done X-ray should be interpreted to identify the cause of an ailment and make sure that it's not due to a fracture. An X-ray should be performed as soon as possible after a trauma. It is vital to get a proper examination and to know the underlying cause. A foot X-ray video shows a normal foot X-ray. Normal foot X-ray, a medial cuneiform and lateral cuneiform X-ray are the most common views to evaluate the foot. These images are also important in diagnosing a sesamoid. It is important to understand the position of the feet before an X-ray is performed. These X-ray views help your doctor see the bones in a better way. A normal foot X-ray video is an ideal tool for diagnosing various foot conditions. A lateral view of the foot shows the lateral cuneiforms, which should be aligned with the 2nd metatarsal on an oblique view. A 3rd type of lateral cuneiform view shows the lateral cuneiform on the DP. Anterior and oblique views show the 1st and the 2nd metatarsals. A standard X-ray study of the foot should include an AP, lateral, and oblique view. The AP view is the most important of these views, because it can detect Hawkins's sign, which is a sign of sufficient vascularity in the talus. This sign can occur 6 to 8 weeks after a talar neck fracture. The AP view is also helpful in diagnosing a fractured talar neck. AP and lateral weight-bearing views are the most accurate X-ray views of the foot. AP and lateral views provide the most detailed information and allow for accurate evaluation of the deltoid ligament and the integrity of the talus. The HDP view is the best way to diagnose the talus. There are many benefits of this view. You will never have to worry about it hurting your patient. Normal foot X-ray, normal foot Xray, normal foot Xray.